Hello everyone, welcome back to the channel. Now if you didn't already know, when I'm not making these videos, I am a pharmacist, and that means if there is one thing I know about, it's how medications work. So I'll be sprinkling in some videos where I explain how some common medications are used, especially medicines used to treat the chronic health conditions that I have already done videos on. So first up today, I will be going through some blood pressure medications, and if you haven't seen my video on high blood pressure, make sure you click here to go see that, because this video will be a good follow-up. Now this video is going to be useful to you if you are someone that is using these medications, if you know someone using these medications, or if you are a student that needs to just learn how these work. Trust me, once you understand how a medication works, then it becomes easy to understand why certain side effects pop up, and you can also understand the health condition a lot more. So let's get into it. Today I will be focusing on two specific groups or classes of medications for blood pressure. And when it comes to blood pressure medications, there are quite a few classes and types, as you can see. They all have the goal of reducing blood pressure, but the way they go about it is different. Now, within these classes, you will have a few different medications, but because they belong to the same class, they do work in the same way. And like I said, I'll be talking about two of these classes today. And that's because these two are similar in a way. They both act on a hormonal system in the body, and that is called the RAAS system, or the renin, angiotensin, aldosterone system. Now this is a system that makes sure your blood pressure is in the best range possible. It regulates your blood pressure, preventing it from going too high or too low. And how does it do this? Well, I'm just going to give a brief explanation now so that when I bring in the medications, it'll be a bit easier to understand. When your blood pressure or blood volume drops, your kidneys are actually the ones that detect this, and they release a special enzyme called renin into your bloodstream. This will then start a string of reactions in your body that give you the end result of producing something called angiotensin 2. And this leads to a few things. The first is vasoconstriction. Angiotensin 2 is a strong vasoconstrictor, which means it will narrow blood vessels and increase blood pressure. Not so great if you already have high blood pressure. And the second is that you get a release of a hormone called aldosterone, which gets your kidneys to reabsorb more sodium and water from urine so that it's kept in the body. And this also leads to increased blood pressure. So the RAAS system is great when you need a boost to your blood pressure, but you can see how it would be a little bit of an issue if someone already had high blood pressure. Now you may be thinking, this system seems to only get activated when someone's blood pressure drops. So why would it be an issue for someone with high blood pressure? Well, that's a very reasonable question. But the thing is, when you have high blood pressure, your blood vessels are narrowed. And this can mean that less blood is entering your kidneys. So your kidneys think that your blood pressure has in fact dropped. And then it starts this process to fix the situation, and it's just this absolutely terrible cycle because your heart and your kidneys have awful communication skills. So that's why the medications that I will get into today are important, because they help in this situation. So the first group that I will be talking about is the ACE inhibitors, and a good way to remember if a medication is an ACE inhibitor is if the medicine ends with pril. So you can see in this list here we have ramipril, perindopril, all the medications end in pril. And these are a very common blood pressure medication, and one of the first ones that your doctor will probably turn to and put you on if you are diagnosed with high blood pressure. So how does it work? Well, ACE stands for angiotensin converting enzyme. And if you have an ACE inhibitor, then the medication is inhibiting or reducing the effects of this angiotensin converting enzyme. Now, this is the reaction that this enzyme is involved with. You have something called angiotensin 1, and through a reaction, it gets turned into angiotensin 2. And this should sound familiar because it's a reaction that takes place in the RAAS system that I just talked about. Now, for this reaction to happen, you need angiotensin converting enzyme, or ACE. And these medications stop this from happening. So the end result is that you don't get angiotensin 2. So how does that impact on blood pressure? Well, Angiotensin 2, this guy over here, like I said before, is a strong vasoconstrictor. This means it tightens your blood vessels, and if you do that, then blood pressure goes up. So, by taking an ACE inhibitor, you prevent angiotensin 2 from being made, and your blood pressure can go down. It essentially helps to stop that vicious cycle where the kidneys keep thinking blood pressure has dropped, and then tries to increase blood pressure. Now, another thing that ACE inhibitors do is reduce the release of a hormone called aldosterone, because if you have less angiotensin 2 flying around, you have less aldosterone release. Now, this hormone, again, as I said before, usually regulates the sodium and water balance in your body. If you have less aldosterone in your body, then you will release more sodium and water through your urine, which will reduce blood volume and therefore reduce blood pressure. So basically, these ACE inhibitor medications are good for high blood pressure because they help stop the RAAS system from increasing your blood pressure, and they do this well. This class of medications is well studied, and they have been around since the 80s, and they are still one of the first medications that a doctor will go to if you have high blood pressure. Now, the second group of medications that work on this RAAS system are the angiotensin 2 receptor blockers. Now, I like to call this group the Sartans, and that is because if you look at the list of all the medications that come under this class, they all end with sartan, and it's just an easier way to remember them. But as their name suggests, they block angiotensin 2 receptors, and hopefully you now have an idea of what that might mean. Because with the ACE inhibitors, we stopped angiotensin 2 being made. But here with the sartans, it's still made, but we're blocking its effects instead. See, angiotensin 2 has to bind to a receptor for it to work, but these medications will block the receptor and therefore block the effects, which means that sartans and ACE inhibitors have very similar effects. You prevent the vasoconstriction and you prevent the aldosterone release, which means blood pressure reduces. It's much easier to understand how the sartans work if you already know how ACE inhibitors work. Now, a common question is, why would someone need a sartan instead of an ACE inhibitor? Well, about 5 to 20% of people that are put on ACE inhibitors will experience a dry cough as a side effect, and it just won't go away. And this is because the medication is directly causing it. This is because the ACE enzyme is also responsible for helping break down something called bradykinin. Now, I'm not going to go into too much, but when you take the ACE inhibitor and stop the ACE enzyme from doing its job, you could get a buildup of this bradykinin in the lungs, and that is what leads to the cough. And for those people affected by this, switching to a sartan medication will be the best, because you aren't stopping the enzyme, you're just blocking receptors, and that won't lead to the cough at all. And that brings me to the end of this video. Now, there's a whole lot more that I could go into with these medications. I could cover side effects, and I could go into medications that you shouldn't take when you are on these medicines. But there's a lot of information that I just went through in this video, and to me, knowing how the medicine works is the most important thing. Once you understand that, then you can go on and try to learn more. But I've gone through what I feel is important, and if you want more, then let me know. But when I do these videos, I will just be focusing on how they work and some of the important side effects. I just think if you're taking a medication, if you're putting something into your body, you should probably know what it's doing to you and how it's doing that to you. Bit of a different video today, but hopefully a useful one. Please don't forget to subscribe and give a like if you enjoyed. I will see you next week, and until then, keep playing the long game.